Hello everyone, today's video is about the top therapies that I recommend for nervous system regulation for my patients. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. Still working from home. My family member is getting better every day. Very excited about that, but still in the hospital, so I'm still working from home, spending a lot of time in the hospital visiting them. So still in casual wear mode, but hopefully I'll be back in a shirt and tie, or anyway, it's a button-up shirt anyways in the not too distant future. So someone had I posted a video a little while ago talking about how we use quantitative EEG, also known as QEEG brain mapping, as well as neurofeedback in our clinic, and that we found that to be really helpful to help get a better sense of what's happening with the patient's nervous system, and then using neurofeedback as a treatment to help regulate their nervous system can be very, very helpful, especially in patients who are dealing with complex chronic illness, because quite frankly, complex chronic illness is, quite frankly, for the vast majority of patients, it's traumatizing. It has not only are you suffering with symptoms, it's impacting your day-to-day life, maybe your relationships, ability to work, finances, the list goes on and on. And it's just such an upheaval. I have an increasing amount of empathy for my patients. I try to be an empathetic doctor in the first place. I've had so many very sick patients over the years. My heart really goes out to all of them. And but just over the last little while, even just seeing how my life has been so disrupted with my sick family member, and he's been sick for about 6 weeks now, getting better and better. He's going to fully recover, and we know that that's going to happen. But for folks who've been suffering for months on end, years on end, sometimes decades on end, and not necessarily ever having any assurances or what's the word I'm looking for, optimism that there's going to actually be that light at the end of the tunnel. Like I just can't really imagine. I can by proxy, but just not firsthand. So my heart just goes out to folks that much more in light of recent experiences that we're having in my family. So with all that being said, the stress, that traumatization that comes from complex chronic illness, to say nothing of all the other traumas that we may have encountered as children, as young people, as adults, stressful situations that are in the past or ongoing. All these things can ultimately sort of congeal to lead to a lot of nervous system dysregulation. So someone had asked the question, posted on that video or on my Instagram, or anyways, somebody had asked the question, well, what kind of therapies are the most useful for helping to get the nervous system in a better state of regulation? So wonderful question. There's the backdrop. So, and it's just kind of funny because I was just having this conversation with my resident the other day. So it's perfect timing. So it really depends on a few different factors in terms of what therapies are the best. There are certain supplements that can be very helpful to reduce stress, reduce anxiety, help to promote better sleep, that type of thing. So there is a role for supplements, and certainly for medications as well. Some of the supplements that I find to be the most useful in my patient population are liposomal GABA. GABA is the most prevalent calming neurotransmitter in the human brain, to my understanding. It's an acronym for gamma aminobutyric acid, and I find the liposomal form is oftentimes very helpful for folks. The non-liposomal forms, I don't really find those work all that well. Sometimes they do, but oftentimes they don't, in my experience. But that can be very helpful to help just settle the nervous system down, kind of give some acute anxiety relief. And it's great because it oftentimes will kick in within about 20 minutes of taking it. So it's not like, oh, I've got to be on this for 6 weeks before it starts to really work. It's it's fairly acute acting. So if a patient needs to take just a couple of doses a day for maintenance, or they need 5 or 6 doses on a really stressful day, like, they have that flexibility, which is really nice. There's an herbal formula that we used to use all the time until liposomal GABA came along. We don't use it as much because liposomal GABA is just kind of more convenient, arguably tastes better, but it's something called Phytocalm. It's a combination of 3 different herbs, lemon balm, California poppy, and motherwort. I'm taking that in a tincture form, and that's something that can be really helpful too. Sometimes 5-HTP is helpful, but that's one of those like longer acting agents that takes a while to build up in the system oftentimes. And then there's another formula called Relora that we really like, which is a trademark, like patented combination of philodendron bark and philodendron and, oh my gosh, what's the other one? Okay, apparently My brain has just done too much doctoring today. I can't remember the other. Magnolia, that's what it is. Philodendron and magnolia. I knew it would come to me eventually. And that one, we usually recommend that more for helping folks to fall asleep at night, but sometimes taking it during the day can be really useful too to help to settle the nervous system down. So those can be some really helpful tools. But at the end of the day, just like pharmaceuticals, like benzodiazepines and SSRIs and things like that, they're for the most part, they're more of a band-aid solution. They're kind of helpers to help us kind of get through the day, but kind of actually doing that work to help better regulate our nervous systems more from the ground up, kind of getting more at the root cause of what's going on is oftentimes the best strategy, the most successful strategy. So we love those helper tools, but there's other things that get more to the root of what's going on. That's what I'm going to talk about next. So neurofeedback can be very helpful as part of that treatment approach. It's something that helps to instigate neuroplasticity pathways in the brain to help actually remodel the way that our brain waves are firing in different regions of the brain. And the most common feedback that I get, no pun intended, from neurofeedback is that folks feel more centered, they feel more calm, they just find that they can regulate themselves better. Oftentimes their sleep is improved. And then we can see downstream improvements with things like chronic pain and migraines and different things like that in some cases. But like reduced anxiety, less depression, less OCD tendencies, fewer ADHD symptoms. Those are the types of things that we more commonly expect to see with neurofeedback. So that can be a really, really helpful treatment. I talk about that in other videos. I actually have an entire podcast episode on my Overcoming Chronic Illness podcast all about neurofeedback, and it's actually a PowerPoint presentation. It goes over how it works and all the ins and outs, so please cross-reference that if you are interested in learning more, if you're not already familiar with neurofeedback. Another therapy that I've found to be very helpful for folks is something called the Safe and Sound Protocol. I also have YouTube videos and on other social media platform videos about the Safe and Sound Protocol, how it works, the ins and outs of that too. So just keyword search that on my YouTube channel, find that information. But the Safe and Sound Protocol, where it involves listening to specially filtered music, it has this really nice soothing effect on the nervous system. I have patients who say, they listen to the music, they feel calmer, they sleep more easily. Some of them actually feel more energetic, I think because their nervous system's better regulated. It's not kind of quote unquote wasting energy on kind of ramping up or revving up parts of the nervous system that don't need to be revved up, and so there's more energy left behind for day-to-day function. So the Safe and Sound Protocol, it's a nice therapy to work with. It's an at-home treatment. It's quite frankly less expensive than neurofeedback. It's more user-friendly because you can do it at home. So there's some really nice selling features there with the Safe and Sound Protocol compared to neurofeedback. Now, neurofeedback is more dynamic, and in my opinion, my experience, neurofeedback is generally pound for pound, it's stronger than Safe and Sound, but I have seen some really, really great results with the Safe and Sound Protocol. I have an upcoming, yet to be released as of this date, which is December 4th, 2024. I'll be releasing this episode probably in early January. I thankfully pre-recorded a bunch of episodes for my podcast before my family member got sick. So I have those stockpiled and I release them every few weeks. But it's with a nutritionist from Washington. And we talk all about Safe and Sound Protocol in there too, more clinical applications and stuff like that. So that can be a really, really helpful treatment as well. The final one that I'll mention here, and there are others, this is not an exhaustive list, but one that I just have a growing affinity for is the Primal Trust system. So Primal Trust is a comprehensive system. It's kind of it is a self-driven online platform. You pay a monthly subscription fee and basically learn about how your nervous system works, how it regulates, what your triggers are, how different exercises or techniques can work to help better regulate your nervous system, eventually kind of getting into what some of the deeper triggers are for where that nervous system dysregulation came from in the first place. So it can be a really, really wonderful therapy. This is quickly becoming a plug for my podcast, apparently, but I have a couple of interviews on my podcast. I interviewed Dr. Kathleen King, who founded Primal Trust. So that is a very it's a very educational podcast episode if you want to learn more about Primal Trust. And then I also interviewed one of my patients named Gabrielle, and she's has had and continues to have a very wonderful firsthand experience with using Primal Trust to help overcome her chronic health issues and we have an interview posted about that as well. So if you're interested in learning more, you can cross-reference those interviews or look on other platforms and learn more about it. But Primal Trust can be really great. It involves kind of a lot of engagement and learning the types of tools and again and triggers and things like that that can be really specific for an individual person's nervous system dysregulation. So those are some of my favorite tools. If you yourself have used any of these tools, please let us know in the comment section if you're comfortable sharing how they worked for you. Any other tools I didn't mention that have been helpful for you, I'd love to hear about that. I hope this is of interest, and I'll leave it there for now.